Right now, doctors are seeing a worrying trend in early childhood vaccination rates. Data from the CDC shows a continued decline in the number of kindergartners who have the recommended vaccinations for their age group. Jim Stratman sat down with a Norton pediatrician to go over some of the numbers and explains what this could mean for your kids.
We've been at a very comfortable rate for a long time.
But things are getting uneasy. Data from the CDC shows a continued downward trend in kindergarten vaccination rates. That means more kids are more susceptible to diseases that had been considered under control. One example, measles.
As many as 31 states now are below the threshold that you need for herd immunity for measles, which puts measles gives it an opportunity to represent itself within a community.
Dr. Patrick Hines with Norton Healthcare breaks down the numbers.
The rates have dropped to 93%, which doesn't seem like a huge difference, but nationwide, if you're looking at 250,000 kids who haven't had their measles vaccine.
Measles is a respiratory disease that affects your lungs and can spread a rash over your body. Before widespread vaccination started in 1963, major measles epidemics would happen every 2 to 3 years, killing an estimated 2.6 million people annually, according to the World Health Organization. Globally, 136,000 people died from measles in 2022, mostly children and mostly outside of the U.S. Thanks to vaccines, the CDC declared measles eliminated from the U.S. in 2000. That led to a stretch of 14 years where cases for both adults and children stayed around or well below 200. After that, you can see the cases start to fluctuate.
That's the problem with herd immunity. Once the vaccination rates drop, things that we thought we had under control then become more of a problem as far as public health concerns.
So how do we fix that? Well, the easy answer is to get more people vaccinated. But Dr. Hines says misinformation and distrust of doctors make that easier said than done.
Science is pretty straightforward. Science is fact-based. Science is reproducible. During the pandemic, everybody realized science is kind of messy.
He said as primary care physicians, it's on the medical community to work on restoring that trust between doctor and patient.
We develop relationships with the families. We like to think that we are the primary resource for information for the families, and the internet has kind of replaced that to a degree. That's what we need to work on. We need to sit down, we need to talk to the families, we need to explain to them what is it that you're concerned about? Where did you get that information? What is it that worries you most about it? And sit down and explain where accurate sources of information can be from.
So parents can feel confident they're keeping their kids safe.
And that's all they're trying to do is filter through the misinformation to do the best thing for their child. And that should be our job to help them get to that path.
Measles isn't the only disease seeing a decline in vaccination rates. In fact, take a look. The CDC says that vaccinations for DTaP, Hep B, polio, and varicella all start trending down in 2018. Each of those diseases are now at their lowest vaccination rate in more than a decade. In the studio, Jim Stratman, WHAS 11, on your side.
Dr. Hines says at the same time we're seeing vaccination rates go down, we're seeing non-medical vaccine exemptions go up. These are for people who have a condition that would make getting a vaccine unsafe, and it also includes personal and religious reasons. Both Kentucky and Indiana only allow religious vaccination exemptions.